My name is Jamie Kunst. I'm a regional ombudsman with the Office of Ombudsman for Long-Term Care. I have Larry Clausen here with me, who's one of our esteemed volunteers. Larry, I'm curious, why do you volunteer with the Office of Ombudsman for Long-Term Care?
Well, I retired about 3.5 years ago, and in retirement, one of the things that happens is you start looking at the future a little differently, and I just felt that I really wanted to be involved in long-term care, partly because I was getting older, and you never really know what the future holds for you. And I had also worked professionally in long-term care during my career. I had always been on the provider side. So I decided I wanted to come back and see if I could help support people in assisted living and nursing homes with, I guess, the everyday kind of common issues that occur in congregate living. How about you? What got you into long-term care or into the ombudsman program?
Yeah, that's a great question. A lot of times I get asked that question from professionals out in the field regularly too. They ask, what's the path to becoming an ombudsman? And there isn't a clear path within our office. I can tell you from me personally, I've been in health and human services for over 20 years. And so for me, it's a very, very broad motive in terms of simply helping other people. In this role, I've found to be extremely fulfilling. The intrinsic reward system, I always tell people this is privileged work.
Hmm.
Uh, and so that's kind of how I arrived here.
Mine was, kind of like yours as well. It wasn't a selected pathway. Um, I had graduated with a degree in social work, and um, then I just happened to have an opportunity to go to work for a company that provided residential services for people with developmental disabilities. And from there, things just kind of took on a life of their own. Um, I really enjoyed working with people that had varying needs, and I always felt that it was kind of a professional calling. It's really only in the last couple of years where it's a lot more personal. When you go into a facility and see something that needs to be addressed, it almost feels like it's affecting me individually because, like I said earlier, I could see myself being in that position of a client, um, hopefully down the road, but ultimately maybe having to rely on nursing home staff or assisted living staff to meet a lot of my needs. So I really, really feel kind of a kinship with people that are living in those facilities now, much more so than when I was working as a professional.
Yeah, and I can really relate to that. And I appreciate you bringing that up. You're talking about the relationships and the emotion associated with this. And the regional staff, as well as the volunteers, we're both out in the field regularly. I spend the majority of my time in skilled nursing facilities and assisted livings. And it really provides me the privilege of building relationships and getting to know people and hearing their story and really getting to know them at a personal level. I know our leadership team often likes to refer to our office as the boots on the ground in long-term care. And when your boots are on the ground and your bedside with a consumer, sometimes you can feel some of their emotion, whether that's positive or negative. There's certainly a lot of good things that happen in long-term care. And then oftentimes there's some things that aren't so favorable. And so it does become emotional, but that ability to connect with people that seemingly are oftentimes quite isolated in the long-term care setting really is a component that I appreciate, and getting to know those stories and then being able to help people. Really, ultimately, as a regional ombudsman, we have really two guiding principles. One of them is to enhance or amplify the voice of the consumer, number one. And then number two, to improve the quality of life of the consumer or to assist them in that process through empowerment.
Well, that concept of collaboration kind of stands out for me as well, because um, when I was a working professional, I brought with me some credentials and some status to influence change. As a volunteer, it's a little different because you have to you really have to collaborate to incentivize people to kind of go down the middle of the road as much as possible. So uh, I remember clearly working with an assisted living facility where I had a client that was visually impaired, and quite honestly, they didn't have a clue about how to come into conformance with the American with Disabilities Act. And so I spent a lot of time talking with them and giving them examples of what some other facilities were doing. And ultimately, they made all the changes that were necessary, and they did it with really sort of a pleasant demeanor. They weren't grudgingly doing it. They wanted to make the change to help this particular client. So anyway, I think it's just one of those things where you have to really be willing to come to the level of the people you're working with and see things through their eyes. And you kind of said that earlier, Jamie, that you kind of see life through the eyes of your clients, and I think that's the most important part.
And I think it's important to highlight that most oftentimes, if not all, there is a shared priority in terms of quality of care, in terms of quality of life, and it really is principle driven work. I mean, it's on our ethical ideas of being our brother's keeper, or treating your neighbor as you'd like to be treated, or whatever your belief system is. But it really does highlight some of those those core beliefs that I have, and that's what I find so rewarding in the role. Is, like I said earlier, the intrinsic rewards that come with being a regional ombudsman with the Office of Ombudsman for Long-Term Care. Hey, Larry, I wanted to thank you for your dedicated service to the people that are consuming long-term care services here with our office. It's incredibly important. Our volunteer network certainly helps expand our service delivery. And the work that you're doing, as you know, at an interpersonal level is extremely important, extremely appreciated by consumers, and also extremely valuable to our office, both the leadership as well as the regional ombudsman. So thank you for volunteering with the Office of Ombudsman for Long-Term Care. And a shout out with regards to it being Older Americans Month and us working in collaboration to serve those that oftentimes categorically fall within that area. So thank you very much, Larry, for your volunteerism.
Well, thank you, Jamie, and back at you during this really important month of older Americans. I think it's really essential that we reflect on the long winter we've had, both figuratively and literally, and the work that was done behind the scenes by the regional ombudsman to keep the flame going and do the outreach that was necessary to sustain people living in nursing homes or assisted living. I think without the efforts of the regional ombudsman, things would be probably a little bit more critical than they are now. And of course, I think you, Jamie, and your cohorts are kind of leading the way to get things back on track. And as a volunteer, I'm really, really excited about that. I'm looking forward to when I can step for the first time into my assigned facility and greet the residents and start doing things that I think are meaningful for them. So my thanks to you, Jamie, for your hard work.
Thank you, Larry.